promised you we're going to help deal with suffering and distress on the other side of the last song. So I'd like to ask you, is there a memory that causes you distress? Because psychotherapy contains both mainstream established techniques and new experimental methods to take the power out of distressing memories and ease our suffering. Prince Harry mentioned earlier this week that he used a technique called EMDR to heal long-standing trauma. To summarise some of the main methods we can use to take the power out of our most difficult memories, I'm joined now by psychologist Dr. Rachel Hannam. Hello, Rachel.
Hi, Ashwin. How are you?
I'm good, thank you. What is EMDR?
So EMDR stands for eye movement desensitization and reprocessing. And it's a form of psychotherapy that was developed sort of through the 90s, where a client is asked to recall some distressing or disturbing images from the past, but with the therapist directing them to engage in what's called bilateral stimulation, so side-to-side rapid eye movements or hand tapping or something that activates some different processes in the brain, and in doing so they can over time reprocess those emotional memories, the disturbing memories, so that they don't produce the emotional responses that they used to. It kind of neutralises the memory.
Is there something about moving your eyes while you're thinking about a dark memory that makes it seem more normal?
I think so, and we don't really know completely the science behind why this works. But if you think of the stereotype of the therapist holding a watch, and the person, watches it go from side to side, there's one part of it is that it does put people into a bit of a hypnotic trance, which is really just a very relaxed state. So their body and brain is relaxed while they're recalling the disturbing image or memory. And through the process of processing those memories differently and recalling them but in a calm state, they end up with a neutral sort of experience of that memory, so it doesn't produce that emotional response. And in the end, they may actually feel pride that they were strong enough and survived that experience rather than feeling powerless, helpless, scared or ashamed.
What sort of anecdotal evidence have you had that this therapy works for people?
Well, there is some emerging research data which I'm not across, but in our practice we have a few therapists who do EMDR. I'm actually not one of them, but I'd like to learn it. And the clients we see have reported that within about 6 sessions, which is quite a short course of treatment really, they have experienced significant benefits in terms of being able to hold their memories differently, decrease fear, shame, anxiety, helplessness. So anecdotally, we're hearing really good things about EMDR.
You're listening to psychologist Dr. Rachel Hannam talking about how we can take some of the sting out of our most painful memories. One technique that you do yourself, Rachel, is imagery re-scripting. Is that the word for it?
Yeah, that's what it's called in Schema therapy, which is a form of therapy that I use. And in imagery re-scripting, it's a simple sort of idea, really. We've got the memories as they sit in our mind now, where we felt at the time, powerless, shocked, hurt, fearful, ashamed, whatever the painful experience was. And we've got that in there. It's all mixed up with those emotions, and it just kind of sits there. But in imagery re-scripting, we visualise with the client what it was that they wish would have happened or what should have happened. And then they get a visceral experience of what it would have been like had that person behaved differently, more sensitively to them, or if someone had have come into the scene and helped them, protected them or supported them in some way. So I'll give a quick example of that, if you like, from my own life. Would that be helpful?
Yes.
So when I first learned about this, for some reason, a memory came back to me of being in preschool, where I got a big smack on the backside from my preschool teacher, who I loved. And I don't know why this memory came back, but I obviously remembered it because it was a shock to my system. And when I reimagined or re-scripted this in my mind, I just imagined my preschool teacher saying, "Come on, Rachel, it's time to clean up the blocks. You've probably forgotten. Come on, off, instead of smacking me." Now, if she had have been able to handle her emotions, she wouldn't have smacked me. I'd have no memory of that day. And I guess my innocence would have remained intact. I was just a little kid who got sidetracked. Instead of packing up the blocks, I was playing with them with my butt in the air, ready to be smacked, mind you.
Yeah. I think I automatically used to do this as a child. Mr. Skilton, my standard 3 in New Zealand teacher, used to tell me off sometimes, and every time he would do it, I would remember Mr. T. I would imagine Mr. T from the A-team coming in and sorting out Mr. Skilton. So my memory of it was much more positive. Is that what this is? You just change the script somewhat in your favour.
Exactly. Yeah. And so when I re-scripted in my mind my 4-year-old memory, I realised even though I was left scared and ashamed, that wasn't my fear and shame, that was my teacher's. She obviously felt out of control. So for me, it enabled me to kind of give back that feeling to her, which ended up in me. But yeah, it's the power of the imagination to, as you did with Mr. T, imagine it happening differently, kind of getting a real physiological sense of what that would have been like. And with my clients, I say, it's not like you're going to forget the original memory, but now you have this overlay. You've reimagined it, you've re-scripted it. And what does that feel like? And people say, oh, now I feel calm, I feel relaxed, I feel innocent, I feel supported, I feel protected, I feel, it's a better kind of feeling. And so now they can sort of put these side by side. And I think for some people it restores a sense of their own innocence, which to me is like an antidote for the shame that they might have felt and fear.
Mr. Skilton ended up in so many wedgies in my mind.
In your imagination.
Yeah, and plenty of them. I was going to ask you, though, is there a limit to how much we can re-script the story? Because we're creating something that didn't happen. Is there a limit to what we are allowed to do in order to still trick our brains or have them come along with us?
Well, I do find, I don't know about a limit, but I find some people respond better. Some people are naturally very high on imagination. And for those clients, it can work really well. In more serious trauma, I've imagined, now we're going to send in a strong, wise adult into that scene and, maybe a kindly police officer or some wise, kind adult who's going to act protectively and compassionately. And like any intervention or technique, it's not going to work for everybody, but I definitely find for some people who've got good imaginations, they get that visceral sense of what it would have been like had they been protected or supported or respected. Other people maybe don't have such vivid imaginations and they might need other techniques, and we draw from a range of bodies of work and techniques to deal with disturbing memories and trauma.
Do you have to keep replaying the new script in your head, or eventually does it become stuck there?
Yeah, I think that I do ask my clients to go from the session, go home and keep imagining the new scenario that they've imagined and created in their head, and just get a felt sense of what it's like to have their needs met. Really, this is about having their needs met and honoured rather than what they got, which was, not getting their needs met and honoured. So yeah, if they keep doing it, keep practicing the new image in their mind, they will start to get a sense, many of them, of, oh, that's what should have happened. My needs do matter. And if that had have happened, this is how I would have felt. And then the inner experience of that feeling becomes a new resource, in a sense, for them to draw upon.
Is there anything you can do to stop your mind resisting this process because it knows it's being manipulated? Do you have to be in a particularly relaxed state or suggestible state for this to work?
I think that definitely helps. So I wouldn't be introducing this with a client in the first session usually, because I want them to feel relaxed, I want them to feel grounded, and definitely any form of grounding or relaxation, helping people's nervous system calm down, creates the conditions for them to do this reprocessing or re-scripting. Yes.
What are some body-based techniques that we can try?
Yeah, well, there's been an emergence of both scientific research and of therapies that draw upon, body-based techniques. Some of the listeners may have heard of a book called The Body Keeps the Score by Bessel van der Kolk, a European psychiatrist, and he's done a lot of research now in techniques like not only mindfulness and meditation, but things like yoga. Because one of the things we know in trauma is that people have often dissociated, so they've cut themselves off psychologically from what's going on in their emotional and physical world. And in that state of that freeze response, that dissociation, they're sort of not in their body anymore. They're shut down. And so whatever we can do to get back into our bodies and, come out of that freeze response is going to be helpful. But of course, we don't really want to, because that freeze response, that emotional shutdown, helped us get through. But then later on, it comes at a cost when we can't connect with ourselves or others. So yoga is one of the techniques that is used, and it's very new to be using yoga to help people deal with trauma and disturbing experiences from the past. But as people are doing various positions and stretches, they're encouraged to be mindful, and this helps them get in touch with what's happening in my body and just slowly get used to feeling things again, whether it's physical sensations or emotions, and start to feel safe in their own skin again.
When you say it's new, does someone have to research this and get it peer reviewed to say how you can apply something like yoga in a therapeutic sense? To apply it therapeutically, does it take a bit of research and rigour?
Yeah, look, I mean, it's classic in the medical and psychological sciences that until we've got years and years of data, longitudinal data, that, there's a lot of skepticism around these emerging therapies like EMDR and like yoga therapy. But we do know that, anecdotally, that there's people who are finding a lot of benefit. But there is some emerging, in fact, a yoga therapist I know recently sent me a research paper from a top-tier journal explaining the self-regulatory mechanisms of yoga and how it works in the brain and body, and it was in the journal Frontiers in Human Neuroscience. So we know now that there's these sort of top-down and bottom-up approaches to dealing with emotional regulation and trauma in our system, and we are getting the data now that body-based therapies such as yoga and meditation can be very beneficial.
You're listening to Dr. Rachel Hannam from North Brisbane Psychologists, talking about how we can take some of that heat out of our most distressing memories and make life a little bit easier. You talked to me a little bit earlier about the psoas muscle and so how some trauma can get stored there. Can you tell me a bit more about that muscle?
Yeah, I did mention that to you when we were chatting earlier. So our body does hold on to tension and to trauma in strange ways. And one of the places some people hold trauma is that psoas muscle, Psoas, I think is the spelling. It's a muscle sort of in our core, and it sort of joins the top of our legs through our pelvic floor. And it's the muscle that we use to, crunch our knees up to our chest and assume that fetal position, which is obviously a good reflex for us in survival situations. If we were caught in a stampede, we'd naturally curl up into a ball. So that muscle that pulls your legs up is one that we know can really hold on to trauma. And in some yoga positions, we are stretching that muscle slowly and gently and holding the stretch. And a trauma-informed yoga therapist will help people to slowly get acquainted with sensations and emotions as they hold various stretches and poses and use their breath to come back into their bodies. But that is one of the interesting muscles. I'm still learning about it myself.
What's the emotional freedom technique?
So EFT, emotional freedom technique, is a tapping technique. Again, I don't know a lot about it, and it's one of those ones that's emerging. My understanding, though, is that when people tap on acupressure points, whether it's their temples, above their lip, certain places on the hand, certain places on their breastbone, that they get some physiological soothing, and at the same time as they're gently tapping on these pressure points, the therapist is getting them to restructure their cognitions. So, I accept my stress, I accept my sadness, I accept my headache, rather than I hate this, I don't want this, I can't handle it, which tend to be the negative thoughts we all have when we're in pain or distress. So again, it's using the body, getting more grounded in the body, getting relaxed, and then using our minds in a different way to neutralise some of the emotion.
Is that the one Prince Harry was doing where he was tapping himself as well as he had his eyes closed?
Well, my reading of the news today and yesterday was that he had EMDR, so the eye movement desensitization reprocessing, but that isn't just side-to-side rapid eye movements. It can also be crossing your arms over and doing tapping on opposite sides of the body, which again can have that similar effect of drawing on the brain in a more comprehensive way through the crossing over of the eyes, crossing over of the arms on the body, tapping to get into the body, and then reprocessing that memory to take some of the fear and anxiety out of it. So
if someone is suffering quite extreme anxiety or depression, they may go see a psychiatrist. Is it the case that psychiatry at the moment is focused on CBT, cognitive behaviour therapy, and perhaps medication? And some of these techniques that you've mentioned, some of them are mainstream, but some of them are on the fringes. Are they still waiting for more evidence to come in? If someone is suffering, what should their balance be between a psychologist, a psychiatrist, and some of these techniques?
Yeah, it's hard to answer that question in a generalised way. I know lots of psychiatrists, and I know a couple who do EMDR. I know some wonderful psychiatrists who do various forms of psychotherapy, and some psychiatrists mainly focus on medications. So something people get confused about all the time is psychologists can't prescribe medications. So if there's a need for medications, I always suggest they also have a psychiatrist. But they may work more frequently with their psychologist and just check in occasionally with their psychiatrist. Some psychiatrists love doing psychotherapy, and others prefer to focus just on the medical side and the medications. So it is hard to generalise, but people's best bet is usually to go to their GP, and the GP will suggest one or the other or both, usually.
Rachel Hannam, thank you for your time tonight.
Thanks for having me, Ashwin.